Welcome back to Silvia's Health Hints. Today I will talk about unwanted pregnancy and abortion in Italy. I've planned to treat this subject later, but just today in the morning I got a phone call from a young desperate abroad student who discovered to be pregnant and was searching for a solution. That's why I decided to anticipate this topic. Unwanted pregnancy is a pretty common emergency situation among abroad students. I will treat today only the situation in which the woman already decided to do the abortion, not the decision making. There are various aspects to take care of: medical, legal, and psychological. A good and professional doctor should take care of all of them, treating the issue respecting your individual circumstances and needs. He or she shouldn't judge you or try to influence you in one or the other direction. The personal opinion of the doctor doesn't matter. We start with the medical aspect. The doctor needs to do a profound anamnesis of your medical history to recommend you the best method for you, taking notice also of the psychological stress in this situation. He should absolutely take care of your psychological wellness too, give you support during the whole process of decision making, abortion, and the time after. It's not only about the paperwork. You are far from home and your family, which makes things more difficult for you. Many of my patients didn't want to tell their family about the pregnancy. In Italy, an abortion is possible within 90 days of pregnancy. Nowadays, most abortions are done pharmacologically. The first drug you get interrupts the pregnancy. 48 hours later, you get a second drug, which leads to the rejection of the embryo. The other method is surgically. Both methods have risk factors, which the doctors will explain and discuss with you. In every city there is a public hospital which provides abortions. Your doctor will tell you where to go. Mostly there are 1 or 2 days in the week when you can go without the appointment. To undergo an abortion, you need to have the results of a blood test which confirms the pregnancy. I do this test in my office in Florence at the same appointment when we do the paperwork, and the results are ready the same evening or the day after. But you can also go to any diagnostic institute close to you which provides blood tests. The test is called a beta-HCG test, but you can also say pregnancy blood test, they know. You don't need a prescription for this test. It needs to be a blood test. The urine test is not sufficient and is not accepted. You also need a medical form completed by a doctor and signed by the doctor and you. Any doctor can provide this certificate. You don't need to go to a gynecologist for this. The gynecologist usually have higher fees for the visit, and it takes longer to get the appointment. From the date on the certificate and the blood test needs to pass 7 days before you can undergo the abortion. This period is scheduled by law to give you time to think about your situation and make up your mind without being under pressure. These 7 days cannot be undercut. Only in case of a medical indication with risk for the health of the woman, an abortion can be performed earlier. I hope I've given you sufficient information to deal better with a difficult situation, especially when you are abroad. I hope you will never find in such a difficult situation, but maybe you know friends who are in this situation and are asking for advice or help. So I invite you to share this video and the channel and to subscribe my channel so that it will be available for a lot of people. I thank you for watching this video. As you can see, we are in the Christmas time, so I wish you a wonderful Christmas time, and thank you very much.